Scene, let's go for the skill part. The knowledge part, everyone knows you have to go on and do study for that. The skill parts has got four major stations. There are two stations for the history, three for the examination, then two and two. So around nine stations total are there in this. So what we are going to go out of these nine stations, two stations are for the history and three stations for examination, two for communication, two for posture. So let's begin with the history. All these stations has got some introduction. So introduction, it is going to be the common part, then differential diagnosis. So among the history, you may get the stations like knee pain, back pain, lower limb claudication, hematuria, blood retention of urine, bleeding per rectum, dysphagia, ischemic irritable bowel disease, hypothyroidism, abdominal pain, acute, chronic, anxious patient, headache, seizures, unilateral tonsil enlargement, impotence, groin swelling, pulmonary embolism, inguinal hernia. So this is the history taking. So let's begin with the history taking. What are the common parts? Introduction. So history has got two stations. So there are two stations. Marks are 20, out of which 4 are for communication, 4 for professionalism, 8 for clinical and technical skills, and 4 for knowledge. So this is about the marks, and you said 6 minutes for taking the history and 3 minutes for presenting the case. So whenever you are getting this station, coming on this station, you enter. The first part is you have to how to start it. So immediately you are entering inside. So if there is cabin is there, you have to knock the door. Then smile. Don't be under stress. Just you have to smile. Be confident. Now mention your number, candidate number, whatever number is given. The first thing is when you are examining the patient or taking the history or something, you have to get sanitized hand. Sanitizer is there. You have to sanitize. So look at it. To look at professional, you should have a pen and paper if you're there. Don't break eye contact with the patient. Now you have to look towards the patient. Greet the patient. Good morning. Good evening. Sit in front of the patient on a chair, on the edge of the chair, not in a comfortable manner, just on a chair, as if you are giving more importance to the patient, with a good posture at the eye level, so that if the patient is lying on the bed, don't stand, just sit on the chair right up there. Now approach. So immediately you have to finish all the thing within 6 minutes. You have to approach. First thing is introduce yourself. Dr. Hamid, I'm one of the surgical doctors. Now first immediately, can I confirm your name and age of the patient? So you have to be very conscious about which patient you are going to. So first thing is first you name and age. Just try to remember the name, whatever the patient is telling the name, and around age, 50 years, 60 years, 70 years. So you can decide what word you have to use. Miss, Mrs, Sir, like this, Mr. So now you have introduced yourself. Myself as doctor name and surgical doctor, and immediately we are identifying the patients. Don't waste time. You have to just go for name and age. Then how to start with the complaint. Now this is the history. You're not writing anything, just asking the history. What seems to be your problem? You don't know patient is having pain, swelling, limping, or everything. The patient may start. What seems to be your problem? How can I help you? So you are asking, you are blind, you don't know anything, you don't know about the stations, you are just asking, what is your problem? How can I help you? So if the patient is giving any history, the relevant background, analyze the main complaint, what patient is complaining. Whatever is that, any swelling, unable to walk, unable to smell, unable to this, you don't know any, what is this station? So time, since how long, duration, time when started, and onset. If it is pain, so this rule of Socrates, 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 S means sight. Where is it? Onset, how is it starting? Character, dull aching, sharp, throbbing, and all this. Radiating, is it going to any other? S, sight, onset, when it started. Character, dull, burning, all this. R is radiating. Associated symptoms along with the pain, dizzy, having redness, swelling, fever, all this. Time and duration. When it is starting, early morning, late night, during sleep, or late night, duration 1 hour, 2 hour, exercise repeating. What are the conditions? Walking, sitting, lying down, bending forward, or this, and severity. S site, O onset, C character, R radiate. So you have to remember this Socrates, and immediately you have to question should come in your mind from where. So once you have done this Socrates, now you have to find out the differential diagnosis. Three DDs. You have to keep in mind three differential diagnoses. 1 to 2 questions. Then you have to think of red flag signs depending upon the stations. Weight loss is there, blood in the stool or urine. These are so past medical history, blood pressure, diabetes, hypertension, any of the. Then surgical history, any surgery he has undergone, any medications patient is taking, drugs like current medication patient is on, long-term medications, allergy to the medicines. Then you have to ask about the family history. Is there any similar condition in the patient's relatives, close relatives? Social history is important. Smoking, alcohol, how often the patient takes, how much. Then I only one question regarding this. System review, respiratory system, cardiovascular, neurology, one question at one time. Then when you finish these questions, thank the patient. Disengage the patient before start speaking to the examiner. You can say, okay, thank you very much. Whatever information you are given, I will consult with my consultant and shortly come back to you. This is the way you are disengaging. So in the history I told about the differential diagnosis, how to think of differential diagnosis. Any history, any symptoms, any pain or something is giving regarding GIT. If it is about GIT, see for the main complaint, how the patient is selling, bleeding per rectum. Doctor, I'm passing blood in the stools, or whenever I'm going for the motions, I'm getting blood. So main diagnosis, if the old age, you is keeping it CO colon, what are the irritable bowel disease or Ischemic bowel disease, anal carcinoma, perianal cancer, upper GI bleed, or hemorrhoids. Then the patient is complaining of abdominal pain, he is alcoholic or ulcer, acute pancreatitis. The differential diagnosis you have to keep peptic ulcer disease, CA colon, gastritis, abdominal pain along with this diarrhea, irritable bowel disease, infectious diabetical disease or cancer. Abdominal pain, gallbladder stone, again is irritable bowel syndrome, peptic ulcer disease, and all this. Dysphagia, unable to deglutate. Unable patient is having a history of some sticking inside while swallowing, suspect of cancer of the esophagus, motility disorders can be there, achalasia, stricture, esophagitis, foreign body. So this was about the GIT differential diagnosis. Any one question of this motility disorders, achalasia, stricture. Then urinary cases, hematuria, cancer of the bladder, kidneys, trauma or something you have to respiratory, chest pain, pulmonary embolism, chest infection, malignancy, microinfection, costochondritis. Shortness of the breath. If patient is complaining of breathlessness, anxiety, pulmonary embolism, all that. Muscular hip pain, osteoarthritis, knee pain, collateral ligamental tear. General cases, back pain, cauda equina, ankylosing spondylosis, lower limb claudication, preoperative assessment for THR, hip pain, meningitis. Miscellaneous cases, tonsillous enlargement, tonsillar malignancy, non-Hodgkin lymphoma, neck swelling, thyroid mass, single thyroid, multinodal goiter, asymmetrical, all this. Groin abscess infected. Special cases, erectile dysfunction, psychological case, drug, seizures, brain tumors, strokes, infection, all this. In this manner, you have to look for the differential diagnosis.